Good afternoon, everybody. This is your host, Ghazala Alam, with another episode of Ebb and Flow. For the last 35 years, I have been involved in community work. During my endeavors, I noticed the real burden and helplessness that some people, particularly the women from the subcontinent, faced and suffered. This kind of situation had a significant impact on my mind. I therefore embarked on doing something inspiring and productive to bring hope and happiness to the lives of the many. I have selected some beautiful minds to create inspirational and insightful podcasts to fulfill this dream. Today's featured guest is Dr. Shastri Swaminathan.
Working directly with mental health professionals can help me share safe and credible content, which can be a reliable source for my viewers in need. Get ready, folks. It's time to hear some words of wisdom from today's featured guest, Dr. Swaminathan. Dr. Swaminathan is a retired chair of psychiatry at Advocate Illinois Masonic Medical Center and a clinical professor of psychiatry at the University of Illinois, Chicago. He did his residency at the Northwestern University Medical School and has been a physician leader for over 30 years, having served as the president of the Indian American Medical Association, the president of Illinois Psychiatric Society, and the president of the Illinois State Medical Society, just to mention a few. He has won numerous awards for excellence in teaching and distinguished services, both at the state and national levels. He's currently in the leadership of the National Alliance on Mental Illness, Chicago, and the Kennedy Forum, both dedicated to eradicating the stigma of mental illness. It's time to get some deeper insight from our expert guest, Dr. Swaminathan. Good afternoon and welcome, Dr. Swaminathan.
Good afternoon, Ghazala, and thank you for having me on your show.
Thank you. So we'll start with the first question, Dr. Swaminathan. Why should we even be talking about depression?
It's a great question, Ghazala. And before we do it, let me take a moment to commend you on your courage to put up the show this afternoon for our community members. It is something that's very needed. It is one thing that people don't talk very much about. And clearly it is not as glamorous or sexy as heart disease or losing weight, but it is critical to our well-being, especially in our community. So thank you again for doing this. It is so needed for our community. The question of why should we be talking about depression has multiple thoughts in it. First and foremost, depression is a real illness, not just a period of sadness, but a real illness, just like diabetes, just like high blood pressure, and so many other physical illnesses that we are familiar with, and not an emotional weakness, not a sign of character flaw. So this is a real disorder with multiple implications to the human biology, neurochemistry, neurophysiology, all of which we'll cover in the next few minutes. So the idea that this is a real disorder that we need to pay attention to is important. Secondly, the cost of not paying attention to it, the cost of not taking care of it, is phenomenal to our community. The sheer cost of the economic impact in our society goes into the billions of dollars. I'm talking about hard, fast dollars and cents, not so much about the suffering that people go through. Now, this is partly the direct cost of providing care, screening, etc., but the indirect cost of loss of work, absenteeism, disability, impact on other illnesses, family members, time taken off from the workplace, those amount to a huge amount of cost to our community. So it is important that we talk about this and find ways of dealing with it. And lastly, I would say that much that we think about the fact that depression has to have a cause and we look for it, and therefore when we don't have it, we begin to wonder why we are. Depression does not need to have a reason. There are many causes, of course, that we understand, biological, chemical, social, but there is really no reason. So when people wake up one morning and feel really low and start to feel depressed, they begin to ask themselves, what's going on? I've got everything in my mind, my heart, my life is full. Why am I feeling this way? So it's important that people understand that this very real disorder can affect without any obvious causation. Last but not the least, of course, it can happen to anyone. No one is immune to this. Rich or poor, young or old, all age group, all sexes. I mean, there's just nobody who's spared from this terrible malady that affects us all. So when you put all that together, it occurs to me that one should be paying a lot more attention like we are doing today. So that, I think that those are some of the issues involved. I'm sure as we go on, we'll talk more about each one of them in some detail.
Dr. Swaminathan, can anyone get depressed, or some people are just more prone?
Yeah, so obviously there are some people, either you call it genetically prone or prone because of multiple trauma or because of changes in their hormones. Postpartum is an example of that, the postmenopausal example of that. So there are obviously some people who are more prone. अब ज़्यादातर देखिए आप गजाला जी, ऐसा माना जाता है कि ये औरतों में, फीमेल में ज़्यादा प्रेवलेंट होती है. मेरा ख्याल तो ये है कि women generally tend to ask for help a little bit more comfortably. Men tend to be more hesitant. So the diagnosis is sort of not as frequent, and they're underdiagnosed because of that reason. But in general, women get significantly more affected. Certainly the opposite in the age groups, younger age groups, young adults, and older age groups, very old people, are highly susceptible to feeling depression for multiple reasons that we will go into. But मेरा ख्याल है कि हम में ऐसा कोई भी नहीं है जो डिप्रेशन से बच सकता है. हाँ, ये जरूर है कि कुछ पॉपुलेशन ज्यादा रिस्क में है, जैसे मैंने आपको बताया अभी. But on the whole, I would say that it is an equal opportunity sort of an illness. It affects everybody.
No, so but from what I understood that you just said, so it is true that women suffer more from depression than men? Is that what you said?
They are more often diagnosed. The incidence is significantly higher in women than men.
Okay.
Ironically, and maybe this is a little premature to talk about it, the terrible consequence of depression, which is suicide, actually happens more in men. They do it more successfully, and they do it more often. So women might attempt it more frequently, but it's a lot more serious than men. They attempt it successfully. But I was trying to say to you that I think women generally seem to get clinical attention a lot more. Certainly around the phases that I mentioned to you, the hormonal phases of life in general. So those are some of the issues we talk about.
Okay, Dr. साहब ये बताइए कि लोग डिप्रेशन के बारे में बात करने में इतना हिचकिचाते क्यों हैं?
गजाला जी, मैं बताऊं कि अगर मैं कहूं आपसे कि डिप्रेशन की इंफॉर्मेशन में, डिप्रेशन की डिस्कशन में, डिप्रेशन के डिबेट में सबसे इंपॉर्टेंट चीज है, और वो जो आपने ये सवाल पूछा है, वो है स्टिग्मा. मैं हमेशा से कहता आया हूं कि डिप्रेशन का ट्रीटमेंट ना मिलने की वजह 3 है. पहला स्टिग्मा, दूसरा स्टिग्मा और तीसरा स्टिग्मा. इतना इंपॉर्टेंट है ये. और मैं स्टिग्मा, अब आप जैसे डिफाइन कर सकते हैं उसको आप, मेरे ख्याल से स्टिग्मा एक तरह की शर्म समझिए, एक तरह का झिझक समझिए कि लोग क्या कहेंगे मेरे बारे में. मैं कमजोर हूँ, कैरेक्टर फ्लॉ है, और कोई किस्म की वीकनेस है. तो ये जो हम एक्सपीरियंस करते हैं कि लोग क्या कहेंगे, और वर्क प्लेस में जो नजर देखते हैं हमको नजरिया से, वो अलग होता है. तो मेरा ख्याल ये है कि स्टिग्मा एक ऐसी वजह है, रीजन है, जिसकी वजह से लोग ट्रीटमेंट नहीं मांगते, किसी से शेयर नहीं करते. अब आप देखिए, अगर मुझे हार्ट डिजीज हो, स्ट्रोक हो गया हो, हार्ट अटैक हो, मैं बड़े आराम से कह रहता हूँ लोगों से कि भाई कल मैं हॉस्पिटल में था, मुझे ये फलानी बीमारी हो गई थी, सर्जरी हो गई थी. पर मैं कभी किसी ये नहीं कहता कि मुझे उदासी हो गई थी, डिप्रेशन हो गया था, क्योंकि मैं झिझकता हूँ कहने से कि लोग क्या कहेंगे. तो ये स्टिग्मा जो है, मेरे ख्याल से बहुत जरूरी है इसको एक थोड़ा डिटेल में डिस्कस करना, क्योंकि स्टिग्मा हर जगह अलग अलग तरीके मैनिफेस्ट करता है. ये आपको नजर आता है. एक तो हमारे सोशल सर्कल्स में हम छिपाने की कोशिश करते हैं कि किसी को पता ना चले. ऑब्वियसली हमने रीजन बताया उनका. दूसरा है वर्क प्लेस में. लोग काम पर नहीं आते क्योंकि डिप्रेशन है, झूठ बोल देते हैं कि हमको फ्लू हो गया था, कोल्ड हो गया था। कभी कभार बिना बताए छुट्टी ले लेते हैं क्योंकि उनकी इतनी हिम्मत नहीं पड़ती बताने की कि मेरे को डिप्रेशन था। और वो जब लौटते हैं काम पे डिप्रेशन की ट्रीटमेंट के बाद में, वो एक अलग किस्म की स्टिग्मा है, क्योंकि वो लोग क्या कहेंगे, क्यों गया था, क्या हुआ था। तो एक तरह की डिस्कशन, गॉसिप कहिए उसको, ऑफिस प्लेस में शुरू होता है, जो इंसान को और भी तकलीफ पहुंचती है उससे, बहुत ज्यादा मुश्किल होता है उसके लिए उसके बारे में बात करना। वो अगर वो चाहे भी आके कहे कि भैया मुझे बीमारी थी, मैं बिल्कुल ठीक हूँ, ट्रीटमेंट मुझे मिला, ट्रीटमेंट सफल था, ये कहने में तकलीफ होती है क्योंकि डरते हैं लोग क्या कहेंगे। ये चीजें आप कहिए सोशल पॉलिटिकल लेवल पे भी अगर आप देखें कि फंडिंग मेंटल इलनेस रिसर्च को या मेंटल ट्रीटमेंट को कम मिलता है, क्यों मिलता है? क्योंकि पॉलिटिशियंस भी हिचकिचाते हैं इसके बारे में बात करना, डिस्कस करना। अब हार्ट डिजीज, कैंसर की फंडिंग की, एजमा की फंडिंग बिना झिझक के मिल जाता है आपको। डिप्रेशन रिसर्च की फंडिंग में मुश्किल इसलिए होती है क्योंकि पॉलिटिशियंस भी थोड़ा हिचकिचाते हैं बात करने में इसके बारे में। तो मैं कहूँ कि स्टिग्मा एक परवेसिव फिनोमिनन है जो हर तरह से डिप्रेशन के ट्रीटमेंट को, डायग्नोसिस को, उसके फंडिंग को हर तरह से इंटरफेयर करता है।
वेरी इंटरेस्टिंग। अच्छा डॉक्टर साहब, ये बताइए कि डिप्रेशन की वजह क्या है? आई मीन अपार्ट फ्रॉम द ऑब्वियस लाइक लूजिंग अ लव्ड वन या जिंदगी के दीगर तबाहकुन वाकयात के अलावा लाइक कैटास्ट्रोफिक लाइफ इवेंट्स, व्हाट कॉजेस डिप्रेशन? व्हाट कॉजेस डिप्रेशन?
$1 million question. I will attempt to answer because I don't think we're 100% sure exactly we know, but it is a multifaceted, multi-causal illness. Genetics plays a huge part. We know almost 80 different genetic variants that are involved in depression at some level or the other. We do know it runs in families. One of the common questions we ask people when they come to see us is, "आपके घर में और कोई तो नहीं जिसको ट्रीटमेंट मिल रहा है?"
जिसको, I'm sorry, I didn't understand. जिसको
ट्रीटमेंट मिल रहा हो या किसी की डायग्नोसिस हो। अगर मैं पूछूं कि भाई आपको ब्लड प्रेशर की डायग्नोसिस है, आपके माता पिता को या किसी और को, पेरेंट्स, कजन्स को, सिबलिंग, किसी और को हाइपरटेंशन है, डायबिटीज है, हार्ट डिजीज है, बड़े आराम से बता देते हैं वो। अगर मैं उनसे पूछूं कि आपके फैमिली में और किसी को है, और यूजुअली it runs in families fairly significantly. Chances are one family member has it, another family member has it, or a relative has it, a parent. So there's a genetic variation. Then there's a hormonal influence. We talked about postpartum, where there's a huge fluctuation of estrogen, progesterone levels that could possibly cause it. And of course, these people are genetically prone to having the illness in the first place. Seasonal variations. There are things, there's actually a diagnosis called seasonal affective disorder or seasonal depression, which basically means that these people have certain months, particularly fall and winter, when light is an issue, that they become much more depressed. Stress and trauma, particularly in the early years of life, बचपन में जो लॉस होता है, माँ बाप को लॉस या और किसी की ट्रॉमा पहुंचती है, उसका अडल्ट लाइफ में मैनिफेस्टेशन, डिप्रेशन, लो सेल्फ एस्टीम, लो कॉन्फिडेंस एक इंसान को प्रोन कर देती हैं इलनेस के लिए. एंड लास्टली सब्सटेंस यूज, अल्कोहल यूज, कोकेन यूज, हेरोइन यूज, इसका बड़ा जबरदस्त एसोसिएशन डिप्रेशन के साथ में. Lot of times these people have a comorbid depression, in part that's connected to the alcohol and substance use that we talked about. So there are many other reasons, but I think these are the key issues that we should be involved and we should be thinking above and beyond, as you mentioned, the loss of a loved one.
Okay. डॉक्टर साहब, हर कोई अपनी जिंदगी के किसी ना किसी मोड़ पर, we feel blue, we feel a little down, उदासी महसूस करते हैं. तो हम कैसे ये कह सकते हैं कि भाई ये एक सिर्फ बुरा दिन है या एक बुरा हफ्ता है? How can we tell that we have an illness?
It's a very excellent question. I think probably the most important thing that we want to have our listeners take back today is how do we make that distinction? And it's not an easy one, because sometimes it starts off as a sadness and sort of slowly progresses into a more serious illness. But उदासी एक आध दिन हो, हफ्ता हो, ठीक है, पर इंसान हर दिन उठ के उदासी महसूस करे और दिन में काफी वक्त उदास रहे, that is beginning to border on a warning sign of depression. changes in your sleep, रात को नींद नहीं आती है या सो के उठ जाते हैं रात को 1-2 बजे रात को, फिर दोबारा नींद सो पाते हैं, और वेट लॉस या वेट गेन, ज़्यादा एपेटाइट आती है। तो ये चीज़ें जो हैं आपको एक तरह की वार्निंग है, मिल जाता है कि कुछ ये सिर्फ उदासी नहीं है, दिस इज नाउ गोइंग इनटू व्हाट वी कॉल ए मेजर डिप्रेशन और अ केमिकल डिप्रेशन और अ फिजियोलॉजिकल डिप्रेशन। किसी भी चीज़ में मन नहीं लगना, even people who have normal sadness do find some pleasure. Grandchildren, children, hobbies. तो जब एक किस्म की डिस्टेंसिंग हो जाती है उन चीज़ों जो आपको खुशी देते हैं या प्लेजर देते हैं, that's a very important sign and warning sign that we are now going into a major depressive phenomenon. That is when you lose interest in things that you normally enjoyed doing, whether it's sewing or golfing or music or whatever it is that you enjoy doing, you no longer feel a sense of interest in those activities. Loss of self-esteem, एक तरह का self-doubt, constantly self-doubt होना on a prolonged basis, बिना बात के रोना आना, आप उठते हैं कोई कुछ हो नहीं रहा, आपको एकदम रोना आ जाता है. So that kind of crying spells, as we call it, which doesn't seem to have an immediate connection, or maybe it's an overreaction. टेलीविजन में कुछ चल रहा है, आप देख रहे हैं टीवी पे, एकदम से आपको रोना आ जाता है और आप समझ नहीं पा रहे कि भी मैं पहले ऐसा शो देखती थी या देखता था, मुझे कभी ऐसा महसूस नहीं हुआ. So those are beginning telltale signs that this is not an ordinary sadness that comes and goes or lasts for a couple of days and goes away. This is more pervasive. So when you have udasi or depression for more than 2 weeks, for example, and when you have other symptoms and signs we talked about, sleep loss, appetite gain, lack of interest in sex, low libido, low energy, low drive, crying spells, ये चीजें जब आती हैं तो इंसान को सोचना चाहिए भी मुझे कुछ हो रहा है. और people who are loved ones in the family will say, भाई, I think our son or daughter needs to get some help because I think this is beyond normal sadness.
This is the question that I was coming to. अगर हमें शक है कि हम या हमारा कोई अजीज या रिश्तेदार डिप्रेस्ड है, तो हमें किससे राब्ता करना चाहिए?
बहुत इंपॉर्टेंट सवाल है, क्योंकि बड़ी बार ऐसा होता है कि लोगों को लगता तो है कि भाई हमारी बहन, हमारे भाई को डिप्रेशन लगता हो रहा है. पहली बात तो उनसे बात करना जरूरी है, उनसे इसके बारे में कि हमको लग रहा है एज अ फैमिली मेंबर कि आप क्लिनिकल डिप्रेशन या डिप्रेशन में हैं. कभी कभार वो इंसान मना कर देगा, वो स्टिग्मा की वजह से कि मुझे कुछ नहीं हुआ, मैं बिल्कुल ठीक ठाक हूँ. तो वो discussion, वो dialogue should be continuous, and it should come from people who care about that individual. To workplace, बड़ा मुश्किल होता है. We see people at work who have crying spells, who are very down, who are very depressed, don't seem to work very well. And it's very difficult to confront them and say, I think you need clinical attention. I think you need to see a doctor. तो बातचीत वहाँ शुरू होती है, फैमिली मेंबर के साथ में, फ्रेंड के साथ में, एम्प्लॉयर के हैसियत से. So these are different approaches. Then the question of if the person says, okay, I think you're right, I'm not myself, I don't feel good, I don't feel normal. What should I do? That's the next step. Or yahan pe, there are different approaches to it. Thank God over the last 10, 15, 20 years, most insurances, most providers have a hotline or a system by which you can call directly and say, I'm so-and-so, I want to go and see somebody professionally, could you make a recommendation? But a lot of people have a hard time making that call.
Okay.
But people have a relationship with their family physician. Blood pressure ke liye chale jate hain aap, flu injection chale jate hain aap. So family doctors are reasonably well trained in recognizing depression, in talking to the patient about depression. So that's a major resource. Unki nurse practitioner hoti hain daftar mein, wo aapse baat karenge. और आजकल काफी सारे sophisticated स्क्रीनिंग टेस्ट आ गए हैं तो डॉक्टरों के दफ्तर में, जो 5-7 मिनट लगते हैं करने में. आपसे सवाल पूछेंगे, आपसे आंसर्स भरने को कहेंगे, they'll make a calculation, quantify it, and say, in our estimate, I think you are depressed, and I think you should be seeing somebody. We have somebody in our office that can probably talk to you, or maybe somebody else can be referred to you. So the sort of a two-step process here. एक तो मरीज से बात करना और उसका ट्रस्ट, एक तरह से ट्रस्ट बहुत जरूरी है कि आप उस बात को एक कॉन्फिडेंस में रखेंगे और किसी तरह नेगेटिव वे में उसको नहीं यूज करेंगे, वो बहुत जरूरी है. और फिर उसको लेके नेक्स्ट स्टेप कहना कि भी I think we should see somebody professionally. We should get some help from elsewhere. This is beyond our support, because initially people try to console, people try to advise, people try to problem solve, and usually depression doesn't respond to those kinds of sort of lay interventions, if you will, and obviously need more professional.
Yeah. डॉक्टर स्वामीनाथन, अगर कोई अजीज, कोई हमारा रिश्तेदार मदद लेने से कंप्लीटली बिल्कुल इनकार कर दे, तो फिर हम क्या करें? आई नो अ कपल ऑफ पीपल एंड आई फील कि है इनको, बट they don't want to go to the doctor. No, they say no, we are fine, we're fine. So what do we do then?
And that's an extremely critical issue and question, and I think you're absolutely right. Particularly हमारे community में, मैं ये नहीं कहूँगा कि stigma local community में कम है, वहाँ पे बहुत ज़्यादा है, और national agencies हैं इसको support करने के लिए. हमारे community में बहुत मुश्किल है एक इंसान को महसूस करना, फिर admit करना कि हाँ जी मुझे मदद की ज़रूरत है. तो मैं उस दो तीन चीज़ें कहूँगा आपसे कि एक तो अगर आपके पास हो someone like me is a resource, physicians are a resource, where you can reach out and call them up and say, can you talk to my family member? Or you can talk to people and find out there are support groups. I know NAMI has resources where somebody who's had depression, who's gone through the same phase you've gone through, can talk to the patient. बहुत powerful होता है. एक इंसान जिसको depression हुआ हो और ट्रीटमेंट मिल सके उसको और फिर ठीक हो गया हो, that's a huge resource and a confidence builder for a person who's going through the depression. कि ये इससे गुजर चुके हैं इस फेज से और उनको मदद मिली है, उस मदद की वजह से ठीक हो गए हैं वो. ये बहुत जरूरी है. Now we do try to give written literature to the person and say, why don't you Google, why don't you read up on it? Depression is so treatable now, and the access is so much better now. There's no reason for you to suffer. This is one of the rare illnesses in mental health where treatment is almost 100%, almost, not quite 100%, but almost there. So the confidence by which a family member, a physician, pastor, masjid mein, temple mein, synagogue, jahan jaate hain aapko, to talk to the person and says there's help available, help is, usually the help results in great improvement. You don't have to suffer. You don't have to go through this. You're not alone. There are people around you who've gone through it. ये चीजें आमतौर से वो डिफेंस को हल्का सा नीचे कर देती हैं, and you're able to access the person's confidence and their trust to get the help they need.
We're running out of time now, but Dr. Swaminathan, podcasts are an excellent way to learn more about mental health issues and common interventions. You have answered so many questions and have provided practical strategies for taking care of our well-being. And really listening to you today, I can probably say that for my viewers, that this can be another great way to process feelings of sadness, depression, and anxiety, and providing them with additional support. I have learned so much from you today, and thank you so much for being a guest on my podcast, and hopefully we can do another one soon. Thank you very much. Would you like to say anything as a closing remark to my viewers?
Thank you for this privilege, Ghazala. I think it's if there's one person we can reach through this podcast who is feeling depressed and feel that they could get some help, there is hope for them, I think we've done our job. So thank you again for doing this. We look forward to doing it again.
Thank you. Thank you very much.